course, we will focus our attention on the basics of diabetes and help you understand what exactly is happening and why. We will discuss causes, symptoms, and we will provide you with useful information on how to successfully manage diabetes type 2. So what is diabetes? The disease called diabetes mellitus comes from two words, diabetes, which is the Greek word for to pass through or siphon, which is described as passing urine or the necessity to urinate frequently, and mellitus, the Latin word for honey sweet. Centuries ago, the physicians would diagnose diabetes by tasting the urine of the patients. In the past, diabetes was known under a few different names, including the Indian word madhumeha, which means honey urine. Today, diabetes is diagnosed based on high blood glucose. There are three main ways to diagnose diabetes. 1. By measuring the fasting glucose. 2. Hemoglobin A1C, which gives a reflection of the average levels of sugar in the last 3 months. And 3. Oral glucose tolerance test. This is the sugar drink test where you are given a sugary drink and your blood sugar is measured about 2 hours later. One of the newer methods to measure blood glucose is through continuous glucose monitors, which is generally used for patients with type 1 diabetes. Simply put, diabetes mellitus is characterized by chronically elevated levels of sugar in your blood. It is a complex disease which affects multiple organs in our body. Diabetes is a term used to describe the body's inability to produce sufficient amount of insulin or use the insulin properly. This leads us to the next question. What is insulin? You might recognize it as a type of medication that people take to manage diabetes, but it is also a hormone that occurs naturally in our body and it functions as main glucose regulator. It is created by our pancreas. It communicates with the liver, muscles, and adipose tissue to balance our blood sugar. So, the way insulin works is when we consume food with carbohydrates, the stomach turns that food into glucose. The glucose then enters our bloodstream. At this point, blood glucose level goes up. The term blood glucose or blood sugar mean the same thing. So, when sugar enters the body, the pancreas receives a signal to make more insulin. Insulin serves as a key to open the cells and let in the glucose. At this point, glucose leaves the bloodstream and enters the cells. The blood glucose returns to normal. The cells turn the glucose into energy. Why is insulin so important? If you don't have insulin and you're not treated, you will die. So insulin is really critical. So let's say you are a young, healthy person without diabetes and you eat a meal. The food from that meal gets broken down and raises the blood sugar. In order to control the glucose level, the pancreas gland is stimulated to release its insulin. Insulin binds to a receptor on a cell to allow glucose in. Imagine the cells in our bodies are little houses with doors that need to be opened to let the visiting glucose in. The job of insulin is to act as a key to open those doors and let the glucose into the cell where it can be turned into energy for the body to use. Think of the receptor as a lock and the insulin as a key. We need the insulin to open the receptor to allow the glucose to come in. When you don't have diabetes, the key opens the lock. That insulin then helps the rest of the body pack away the food substances that have been absorbed. Then, the blood sugar levels are returned back to normal. When you have diabetes, the process is different. There are two problems that could occur. 1. There is no insulin, no key to open the door, and the glucose gets stuck outside. This happens in diabetes type 1. In the second problem, we have the key, but the lock is jammed. This is insulin resistance. This happens in diabetes type 2. In diabetes type 1, the body destroys the beta cells which produce insulin. Therefore, you need insulin treatment. Type 1 diabetes occurs in youngsters and can start at a very young age. Perhaps they had a virus infection or another immune system issue. In that case, the beta cells which produce the insulin in the pancreas gland get killed by the virus, or they can get killed by consequence of an infection called an immune response. Then they have no insulin at all. Diabetes type 1 accounts for about 5% of the diabetic cases. Insulin treatment for type 1 diabetics is absolutely necessary. Type 2 diabetes is a little bit more complex. Your body makes less insulin than normal, and in addition to that, you have insulin resistance in which the cells do not respond as well to insulin. This type of diabetes is generally a consequence of obesity and age. The accumulation of fat inside the cells of your muscles and liver interferes with the action of insulin. If insulin is the key that unlocks the doors to your cells, saturated fat is what appears to jam up the locks. The fat inside these muscle cells can come from the fat you consume through food, or it can come from your body fat. In other words, the insulin is not able to do its job properly. When you have had this problem for about 10, 20, or even more years, the pancreas gland can't handle it and the insulin-producing cells begin to die. This is when you must move from tablets or pills to insulin injections. But why should you get to that stage? As we have mentioned, type 2 diabetes is preventable, manageable, and in some cases even reversible, and the most effective way is through lifestyle and dietary changes. So to sum it up, what is the difference between type 1 and type 2 diabetes? Type 1 is characterized by an immune attack on the beta cells that kills them. And that means you have fewer of the beta cells and they can produce less and less insulin, and eventually you have too little insulin. Type 2 is a combination of lifestyle and diet that causes accumulation of fat at places where it shouldn't be, for instance, in the liver. The more fat there is in the liver, the less sensitive the liver is to insulin. There is also a genetic inability to produce enough insulin to cope with that problem. Diabetes type 1 and type 2 are the most known and most broad categories, but there are also two other types of diabetes you might have heard of. One is prediabetes. Prediabetes means that the blood sugar levels are above normal, but they're below the level needed to meet the criteria for diabetes. When you are in this category, you still have a chance to make dietary changes and lifestyle changes and revert back to normal before you get diabetes. The other kind is gestational diabetes, which occurs during pregnancy. In most cases with gestational diabetes, the mother would return to normal after birth, but getting gestational diabetes puts you at a higher risk for getting diabetes later in life. Who has diabetes and how prevalent is diabetes? The prevalence of diabetes is steadily increasing everywhere in the world. It is recognized as one of the biggest global health challenges in the 21st century. It is estimated that about 422 million people in the world live with diabetes. This number is expected to double over the next 2 decades. Diabetes is very common in the United States as well, with 1 in 10 Americans who have the diagnosis and 3 in 10 Americans that have prediabetes. The CDC estimates that more than 29 million Americans are living with diagnosed or undiagnosed diabetes. That's about 9% of the US population. There are many people who are unknowingly living with diabetes or prediabetes. Usually those are the people who do not keep up with their yearly checkups. More than 1 million new cases of type 2 diabetes are diagnosed each year. In reality, type 2 diabetes is almost always preventable, often treatable, and sometimes even reversible through diet and lifestyle changes. Type 2 diabetes is an unfortunate consequence of dietary and lifestyle choices and is referred to as a disease of affluence. Over the next few segments, we will ensure that you are armed with knowledge on how to manage and control diabetes through diet and lifestyle changes. We will also learn how and when to measure your blood sugar and what those numbers mean. Remember that you have the power to change your life. The challenge in front of you is an indicator of the power within you. If you need additional support, reach out to your nutrition and wellness coach. Mahalo and aloha.